My dear students, pathology, you must be well aware the significance of pathology as a major subject for NEET-PG examinations is immense. Now, I would be just putting up some questions and they will be giving you an idea about what exactly is asked in your examinations from pathology, image-based pathology questions. Now, having a look at the board, and you can see that we will be discussing some of the questions which have been frequently asked, which might be asked ahead, and they happen to be high-yield topics. So we move our focus towards the board and have a look at the questions which are asked. Number one, a question asked: the pathological slide shows Verroque bodies from a 22-year-old male who had a mass lesion. Now, Verroque bodies are a feature seen in meningioma, adenoma, prolactinoma, acoustic neuroma. Now, going straight away to option D. As far as option D is concerned, you are well aware of the term in pathology, schwannoma or acoustic neuroma. And acoustic neuroma is basically a tumor which originates mainly and usually from the 8th cranial nerve. The vestibulocochlear nerve is the 8th cranial nerve, and especially from the vestibular division of the 8th cranial nerve, we have got this tumor sometimes which we call as the schwannoma or acoustic neuroma. Now, there are certain important features about the acoustic neuroma. It can present unilaterally, sometimes bilaterally, and it pathologically is a benign, slow growing and well encapsulated tumor. Now, as far as histopathology of acoustic neuroma is concerned, you have to remember that there are two patterns, Antony A and Antony B patterns, and the difference between Antony A and Antony B is that Antony A is a highly cellular pattern in which sometimes we can be having accumulations of an eosinophilic matter with nuclear palisading and a characteristic word pattern, and this word pattern is given the name as Verroque bodies, and histopathologically you can see Verroque bodies in acoustic neuroma. It is a very simple question, but you have to know the exact meaning of the term Verroque bodies and characteristic feature of different pathological tumors which we come across in pathology. So the other options A, B and C, they are ruled out by simply your fundamental knowledge of pathology. So acoustic neuroma, the option D, happens to be the correct answer as explained briefly. Now, going to the second question, a very interesting question, and you can see that the figure shows a deposition along Descemet's membrane in a young patient who has got hepatomegaly with choreophore movements. Most likely it's a case of a hemochromatosis, phosphorus poisoning, lead poisoning, copper toxicity. Now, we are well aware of a term called as Wilson's disease. And what is Wilson's disease? There is an excessive accumulation of copper in various tissues of the body. And what tissue specifically? Liver, brain and cornea. Many other organs are also having deposition of copper, but these I will be taking up here because the Wilson's disease is also known as hepatolenticular degeneration. Now, if you just divide this term, hepatolenticular degeneration, the liver would refer to hepato, the lenticular nucleus in the brain would refer to the involvement of the brain, and then there will be this deposition of copper in cornea as well. And in what part of cornea? There's an important membrane, the Descemet's membrane. I'm not talking about the Bowman's membrane over here. In the cornea, we have got the Descemet's membrane, and there will be a copper deposition. And over here, you can see in the figure, there is the Descemet's membrane over here, and you can just see that there is a deposition, a streak line which is shown in the figure, but from your clinical sense, from your clinical knowledge, you have to remember that this is a feature of copper toxicity. The option is given in a twisted manner. Copper toxicity would be referred to as Wilson's disease, and it is usually due to defective excretion of copper from the body, and the defect lies within the chromosome 13, and there is deposition especially in the lenticular nucleus as well as the cornea, specifically the Descemet's membrane and the liver. So hepatolenticular degeneration or the Wilson's disease or copper intoxication is one and the same thing. So the option is option D, correct option. Moving to the next question. An 84-year-old male has increased frequency of micturition. The figure below depicts histopathology of prostatic cancer, and it tells you, it wants to inquire from you which is the most common type of cancer in the prostate: squamous cell, adenocarcinoma, mixed cell, or carcinoid prostate. Now, from the oncological perspective, carcinoid prostate, not a common entity. Now, mixed cell tumor, I have not come across this term very frequently. Adenocarcinoma, you have to remember that cancer prostate usually originates from the subcapsular part of the prostate as far as histopathology is concerned, and there is the role of androgens implicated in the causation of prostatic cancer, and it usually presents as a hard, irregular prostatic nodule and can cause frequency of micturition or obstructive uropathy. The clinical symptomatology can vary. I am not concerned about that fact over here, but you have to remember that adenocarcinoma, prostate, is the most frequent cancer of the prostate. Squamous cell carcinoma is less frequent, and in a similar manner, you have to remember that adenocarcinoma pancreas, adenocarcinoma GB are the most common cancers of these organs, and the most important and the most common tumor of prostate is the adenocarcinoma. Then we are having other entities associated with it. The propagation of prostatic cancer usually into the back or the spine or the bones of the vertebra through Batson's vertebral venous plexus, the Gleason score, which are sometimes asked, but they are not mentioned over here, so we skip these points, but these are by the way these points which can be asked in the form of other questions as well. So going on or moving to the next question as well. Now, 77-year-old has a 3 centimeter lesion on his face. Figure demonstrates histopathological tumor showing characteristic keratin pearls, and this keratin pearl would be associated most commonly with basal cell carcinoma, malignant melanoma, squamous cell carcinoma, or schwannoma. Now, as far as squamous cell carcinoma is concerned, skin can be having melanomas, BCC, basal cell carcinomas, or squamous cell carcinoma. BCC is usually referred to the term as rodent ulcer because it is usually or typically in the form of an ulceration. But as far as histopathology is concerned, you have to remember that the characteristic feature of squamous cell carcinomas is that they originate from the keratinocytes, and the squamous cell carcinoma is histopathologically characterized by concentric rings of squamous cells with keratinization, and these keratin pearls are a pathognomonic feature of squamous cell carcinoma, especially the well-differentiated and the moderately differentiated squamous cell carcinomas. So once you remember the keratin pearl, it is also given the name as epithelial pearl, and keratin pearl is a term usually associated with squamous cell carcinomas of the skin especially. So this is something which I would just like to know or deliver about SCC of skin. So the answer to the question would simply be option C, the squamous cell carcinoma. Another question type which was asked is like this. The figure shows a microscopic discrimination of a section of connective tissue dominated by cells with large vacuolated smooth oval cells with nucleus pushed to periphery. Most likely cells are plasma cells, undifferentiated mesenchymal cells, fibroblasts, fat cells. Whether it is histology or whether it is histopathology, you have to be well aware of the features which you see under microscopy of these cells. Now, as far as my knowledge about adipocytes is concerned, even it's normal histology, the adipocytes are rounded, smooth cells, and what they have got a nucleus which is usually pushed towards the periphery, and the whole of the cell body seems to be vacuolated by dissolution of the various stains which we use characteristically in staining adipose tissue, especially the Sudan stains. And what we characteristically see, smooth cells with vacuolated cytoplasm and the nucleus pushed to periphery, and this characteristic appearance of the nucleus pushed to periphery is seen in case of adipose tissue or adipocytes, and this is given the name as signet ring nucleus or signet ring cells. So this is a very important feature of just specifically the option D, the pad cells or the adipocytes, whether it is a benign tumor of the adipocytes or whether it is a malignant tumor of the adipocytes, whether I'm talking here about multiple lipomatous tumors, the liposarcomas, or maybe as a form of teratomas in which we can have a component from the adipose tissue as well, or it can be in the form of Derkham's disease, adiposis dolorosa. So mainly you have to remember that the characteristic feature of round, oval, smooth cells with a nucleus pushed to periphery is a feature of adipocytes, the fat cells. And these are some of the things which are asked in pathology as far as image-based questions are concerned, and you need to have a crisp, clear concept about pathology. You have not to do a revision of your MBBS again by just unnecessarily wasting your time in videos which don't give you the exact information or the precise nature of the questions asked or the precise explanation of the questions which are frequently asked in NEETPG examinations. I wish that this would be part of my effort to help you people in just clearing your concepts, and I hope these will benefit you a lot. Thanks a lot.